There's a lot more. We're learning every day on the thing, and in most cases, it's not good news.
If it could take 50% of my profits away, and it gets to the point where, what are we working for? You know, what are we taking all the risks for in our businesses?
But at some point, you do have to make a really tough decision on what you're going to do or not do.
Welcome to Public Policy in the Real World. I'm Olga Halaburda for the MacIver Institute. We're continuing a conversation with 3 Wisconsin restaurant owners. Segment 2. We ended the last segment talking about the details of the ObamaCare employer mandate. Here are those details. Businesses with 50 or more full-time equivalent employees must provide health care insurance. The law defines full-time as 30 hours a week. Those who choose not to adhere to the mandate will have to pay a tax, which is $2,000 per employee. But it gets a little more complicated. If any worker turns down their employer's insurance and actually receives coverage through the exchange instead, the penalty on the employer for that worker rises to $3,000. If the employer requires a waiting period to enroll in coverage of 30 to 60 days, there is an additional fine of $400 per worker, $600 if the period is 60 days or longer. Gentlemen, I'll ask you, what are your thoughts on that?
I wasn't aware of the provision about the waiting period. To not have a probationary period with your employee when we deal with a lot of people who come in at the workforce that don't have any previous experience, that would almost be unworkable to provide that. I'm not sure how you'd even do that at this point, how you administer something like that. I think we're probably better off at our point. We would save, as I calculate, about $5,000 a year by paying the penalty. But how do you do that? What do you do that when you have an employee that might have worked for you for 20 years, and all of a sudden you say, well, I'm going to save $5,000 this year, so I'm not going to provide you insurance anymore. So I don't think anybody wants to be that draconian with their decision, but at some point you do have to make a really tough decision on what you're going to do or not do.
Yeah, I don't know where it all goes. I look at the average restaurant makes anywhere between 3 and 7% to the bottom line, and you know, if you figure that out per employee, you know, in some of the smaller places it can be, you know, $3,000, $4,000, $5,000 per employee. Now you're gonna absorb some of these taxes, so it could affect somebody like myself. It could take 50% of my profits away, and it gets to the point where, what are we working for? You know, what are we taking all the risks for in our businesses to sit here and it just shrinks that percentage down to a point that it's real difficult to do business.
I asked you to do some math and put in perspective the amount of taxes you pay now and how the Obamacare tax would impact you.
Well, general taxes, as it relates to total sales, it's not related to profit or anything like that. Just total sales, we're currently paying over 16% of our total sales go to taxes, and that does not include sales tax. That's just general, that's income taxes, property taxes, payroll taxes. And with Obamacare, that'll probably go to over 20%.
And how does that affect you?
Oh, it affects you a lot because the restaurant business, the hospitality industry, it takes a lot of employees to produce a dollar. It's not like manufacturing might have, you know, one employee there, and that employee may produce $1 million worth of sales through the course of the year, where in the restaurant business that's not the case. It's one employee might produce $10,000 through the course of the year, so it's going to affect the hospitality industry drastically.
You're in a pretty tough economy right now, and the last thing we want to do is raise prices, but that's what's going to happen, and it's going to shrink your workforce. I really believe that.
And how do you communicate this to your workers?
You know, I guess you have to have some hard discussions with them on what it's going to be, and I've had some folks that have been with me a long time, and you'll have to make those decisions one by one, but you have to be able to stay in business.
I think that some of the employees that won't be some of the people that won't be employed anymore are people who are using our industry as to supplement their family income, where they only want to work 10 hours a week, maybe 2 shifts or 1 shift a week to make ends meet for their own family, and those opportunities are just not going to be there anymore. Initially, that'll be the person it'll affect, the person that is trying to supplement a family income, as opposed to the person who's working for your business full time.
We're going to end it there for segment 2 of Public Policy in the Real World. Please join us tomorrow as we widen the picture and discuss what this means for the future of the restaurant industry and its workers. I'm Olga Halaburda for the MacIver Institute.